Hello, viewers. Welcome to a whole new episode of Medical Media Kenya. This time round, I'm joined by Dr. Gloria Ngare. She's a medical doctor with special interest in children. She mainly cares for children in her service. So, welcome to the program,
Thank you very much, Dr. Kitty. My name is Gloria Ngare. It's a pleasure to be here today. I am a medical officer by profession and interested particularly in pediatrics and child health. That means I take care of children from when they are born to when they turn 14 or 15, depending on what a child means to you. I'm passionate about children because I feel this is the line that God has called me to take care of young labile children and shape their futures for better outcomes, and even so that they can become better responsible adults in life.
Thank you so much, Dr. So, in this episode, we are going to talk about herbal treatments that are used by various communities around the country and also generally in Africa, even around the world, to try to help children before even they get to hospital. So, Dr. What are these uh, types of herbal medication and how has been your experience with children who have used these medications?
Yeah. So I think maybe we can start off from just knowing why herbal medications are being used or herbal treatments. And like you said, Dr. Paul, they use it just before children come to hospital, meaning they're trying to take care of an illness or a superstition about something that their child is having, and therefore they give them this medication. So because right now we have a challenge of knowing exactly what components are there in these medications, we categorize them in a kienyeji way, so to say. First off, we have the ones that they drink or they take through their mouth, so either in form of ashes or burnt herbs the children take, and then there's that they use to clean their skin. So sometimes it could be the same thing. We call it wash and drink here, where they wash the child with it and then give the child to drink. And then there's that is ashy, and they take through, mostly it's through the mouth, taken orally. Yeah. So in terms of my experience, I think we have seen very many children, especially infants, that neonates, sorry, meaning from the birth to 1 month, who have been given these herbal medications, and very many of them have been given by their grandmothers or mother-in-laws to the mothers of these children, to take care of, like I said before, superstitions of maybe an evil eye, or just because it has been done for many generations before. We find that they are given to protect them, to give them like a hedge of covering or protection against illnesses and such things.
Thank you so much. Have you noticed a difference in terms of the locality where these patients come from? Is it mostly from the rural areas, or is it from urban, or is it a mixture of both?
So I think what we've seen particularly is, of course, from the rural areas. These are places where families have had histories of or generational history of having medicine men in their homes, and therefore they use the herbs from maybe their farms, and so it's particularly rural areas. I've not really experienced many urban children or urban families giving these herbal treatments.
Thank you so much. With that background information about the various therapies that are used and the localities where these patients come from, what happens now when they come to hospital? They are sick, and there is a history that they have taken these herbal medications. What are some of the effects that these medications have on the health of a child?
That's a good question. So to understand that these herbal medications are not necessarily, or these herbal treatments are not necessarily therapeutic to say, meaning they're not helping the body in any way. Most of these are toxins and plants that the use is not necessary, their uses are not necessarily known, and therefore the chemical composition of these treatments are not good for the body of these children. Therefore, you find that when they come, they are very sick in terms of, we can start from once they are washed with it. There are incidences where we have seen children experiencing burn-like reactions where their skin starts peeling off and they get infections from just having the skin is basically a protective layer to the body of the child, and it's very important as the first defense mechanism to infections. And therefore, when that is has been excoriated or has come out, then we have children who are exposed to many forms of skin infections and bacteria that are very harmful to the children. Secondly, we see now internal organ damage, so multi-organ damage. These children come in with acute kidney injury because these are substances that sort of prevent the child from even taking orally, because when they come to the hospital, they are already so toxic, and by toxic I mean infectious. They have maybe severe meningitis or just a systemic illness, what we call sepsis, and therefore they have not been taking orally or feeding well, and therefore they come with dehydration, severe dehydration, which leads to renal failure. And also some of these components we are assuming are particularly harmful to the kidney, so causing some form of intrarenal failure. They also have liver damage, and because our liver is what gets rid of toxins in the body, we get these toxins have already destroyed the liver. They come in with acute liver injury, bleeding uncontrollably because the liver is not working well, and they also have jaundice, what we call yellowness of the body or the eyes, and this level of jaundice has also gotten to their brain, and also having some form of acute axonal injury from that as well.